Have you ever been absolutely terrified? One of the scariest moments in my life was being told that my son had to have surgery on his stomach. I can tell you about this today because at the age of 3 weeks old, my son was diagnosed with pyloric stenosis. This topic relates to all of you because some of you may have children, some of you may want children, and it's always good to be aware of childhood illnesses. The purpose of my speech today is to inform my audience about the disease pyloric stenosis. I will tell you the cause, the effects on the body, and the cures for the disease. According to MayoClinic.com, pyloric stenosis is an uncommon condition that affects the opening between the stomach and the small intestine, or the pylorus, in infants. The opening thickens and food cannot pass through to the intestines to be digested. The exact cause of the thickening is unknown, but doctors have linked it to both genetic and environmental factors, such as antibiotics being ingested by the mother during gestation, or there could be a family history of the disease. Next, I want to tell you about the effects pyloric stenosis has on the body. Because food cannot pass through the stomach into the intestine to be digested properly, vomiting is the main symptom of the disease. As stated in the article, The Endangering but Treatable Pyloric Stenosis, the most dangerous part of the disease is not the vomiting, but the dehydration due to it. Failure to gain weight and lethargy are also complications brought on by the dehydration. Because the symptoms of pyloric stenosis are quite similar to those of gastrointestinal reflux disease, also known as GERD, it is often misdiagnosed. Proper diagnosis is a key factor in proper treatment for patients. The doctor will begin with a simple abdominal exam and will most likely feel an olive-shaped lump in the abdomen. If there is a lump, the doctor will prescribe or recommend a barium swallow, which is where the infant will drink a small amount of chalky white liquid, and then special x-rays are done to determine whether there is a blockage or not. Blood tests are recommended to determine the levels of electrolytes and nutrients because the constant vomiting may produce abnormalities in those levels. IV fluids may need to be administered, and the correct form of treatment for the patient is also determined with blood tests. There are two types of treatment. The first is liquid medication, generally given during mild cases of pyloric stenosis found at birth. The second is a surgical procedure known as a pyloromyotomy, where a surgeon will cut a small opening in the thickened muscle to allow food to pass through into the intestine. According to kidshealth.com, once a pyloromyotomy has been performed, pyloric stenosis should not recur. Although children who are diagnosed with pyloric stenosis are at risk of death, this disease is treatable and does have a cure. In summary, my speech today was to inform my audience about the disease pyloric stenosis. I have described the disease, the causes, the effects it has on the body, the cures, and the treatments. The fact that my own son was diagnosed with this at 3 weeks old gives me personal experience with the disease. Being informed about childhood diseases is always good because some of you may want children and some of you may already have children. I hope that you have found the information in this speech useful. I would like to thank you all for your time and attention.